The broadcast is now starting. All attendees are in listen-only mode.
Welcome everyone to today's webinar, How to Leverage ServiceNow Emergency Response Management Apps. We will begin in just a few moments. Alcor is pleased to welcome you all to today's webinar. Alcor is a global cloud advisory and implementation services company serving Fortune 500, government agencies, and other leading organizations in multiple industry verticals across the Americas, Canada, India, Great Britain, and Japan. Alcor is an experienced ServiceNow elite partner. We also partner with leading technology companies like AWS, Oracle, Microsoft, FireEye, Incorda, 3C Logic, Celonis, OneTrust, and others. Our ongoing webinar series is designed to enlighten, inform, and start discussions within your own organizations. If you require any additional information after listening to today's webinar, please reach out to us through our website, www.alcortech.com. We have some time reserved in the end of the webinar for Q&A session, so please feel free to type any questions into the questions section of the webinar dashboard. Today's topic is how to leverage ServiceNow Emergency Response Management Apps, presented by Aleks Dmitrovic. Aleks is Principal Strategic Consulting at Alcor. He's organizational leader with more than 20 years of experience focused on driving strategic advisory, solution design, digital transformation, and operational excellence for customers and clients. Aleks is certified ITIL V3 expert, Microsoft Certified Systems Engineer, and Cisco Certified Network Administrator. I will now turn the webinar over to Aleks.
Good morning, folks. Thanks for jumping on. Today we're going to be looking at emergency response management, emergency response planning, specifically looking at the 4 applications that ServiceNow made publicly available to all of its customers across the board. Obviously some trying times right now, so it's good to see the community come together, help each other out, and trying to really focus in on some key business continuity and, in this case, emergency response planning. Just a quick overview of Alcor and some who we are. Founded in 2008, based out of San Francisco Bay Area and Los Angeles areas. Grown since then to have offices in Japan, United Kingdom, Canada, India, and work with customers all points in between. Worked with a lot of great customers across many different verticals, from public sector, higher education, through to financial, retail, health, life sciences, etc. Sorry, next slide. Within Alcor, I represent the security, risk, and privacy practice globally. As a group, we're focused on supporting customers and organizations across the enterprise. We've got a highly skilled resources, very strong technology partnerships, ServiceNow being one of them. As Anna mentioned earlier, we're an elite partner. We provide customer-oriented advocacy, so independent of any vendor or technology, we try to provide the best guidance based on business needs, strong product expertise, obviously, and we do a lot of work with our customers for everything from advisory and design through to ongoing managed security, risk, privacy, operational services, in support of folks who don't have the resources to do some of this work. So we'll jump in. As everybody on the call knows, COVID-19, a global pandemic, has hit a lot of organizations, a lot of states, municipalities, countries really hard. As a result of this, there's been a great strain on organizations and on state organizations to respond in a timely manner. ServiceNow took an opportunity here to work with a federal client to put something together and released it to all of their constituents and their customers in support of ongoing management and response of during this trying time. The challenges that are being addressed with these applications are very similar to the challenges that a lot of work that's being done in ServiceNow looks at. Unstructured processes, paper-driven, notebooks, email, limited visibility into response teams and availabilities really slows down emergency response. That's obviously a huge challenge. Time is of the essence. And so doing non-value add work or time-consuming activities that could be automated is obviously critical. And the ability to provide the appropriate reporting and oversight is critical as well. So regardless of whether you're a federal agency, whether you're managing things on a state or a local level, or whether it's organizational, it's important to be able to have the things in place to be able to get the information you need, get the information your constituents need, to be able to identify any anomalies, any issues that need to be addressed, and to be able to action those in a timely manner. And so part of what ServiceNow provides in this conversation is structured workflow. And as you'll see in the case of the emergency response management applications, based on federal guidelines to ensure consistent automated processes based on things like FEMA. Ability to resource quickly and efficiently across different roles within those guidelines, to be able to identify locations and people and understand how to approach that, and then of course to be able to provide the level of transparency required to be able to report on these things, whether it's reporting back to federal agencies for funding, or whether it's internally to look at reporting from a business continuity perspective. It's important to be able to have those functions. So ServiceNow, a very good move, has released the emergency response operations apps to the ServiceNow Store, free of charge to all customers. Ongoing, as they make improvements to it, they'll make some updates to it, but it is available and it's free. We'll go through the applications today, look at how to get it, how to set it up, what it does, and then what next steps might be. So very good move on ServiceNow's part. We're very happy that they've done that, and happy to help folks leverage some of those. So when we look at emergency response workflow, a couple of key things that are required. Obviously, we need to be able to respond to an incident, an event, of a higher magnitude than traditional issues or risk within an organization. So we need to be able to identify the needs and respond quickly. We need to be able to prevent the spread, in this case, of health events by improving response and containment, and be able to provide end-to-end digitization of what is typically a paper process. We want to be able to manage resources, people, assets, time, in a time that doesn't afford us a lot of leeway. Identify key locations needed to address some of the crisis, and identify key personnel. And finally, be able to track and document all of this from a reporting perspective and potentially a financial chargeback perspective. So ServiceNow's approach to this was, again, driven by customer need and by industry need, based on some very strong standards, FEMA, NIMS, ICS, so requirement to be able to respond to these kinds of events, the need and the requirement to be able to set up an incident command system, standardized approach to managing these types of incidents. Different kinds of incidents, of course, but in this case, we're looking at healthcare issues. And this one application specifically applies to state and local agencies, federal government agencies, but 3 of the 4 applications can be used by any organization to really track issues, provide awareness to folks, and to be able to really set some boundaries around what's happening and act on it quickly. So what are some of the challenges of this? Again, typically these things are done on paper. It's tough to very specifically initialize these things. Initial planning based on the foundation established by FEMA. It's important to get appropriate coordination and orchestration of activities in alignment with ICS and NIMS guidelines, and the ability to initialize a structured, defined, unique workflow. Perfect opportunity in ServiceNow to respond to something like that. Second challenge from a response perspective is identifying the locations that need to be participate in any response. So having access to a predefined list of potential locations, being able to leverage those and identify which locations are in scope for the response, highly critical within this. Challenge C is resource and role planning. How do you define what kind of roles and what kind of people are required to support the appropriate response? And again, based on those guidelines, there's some key roles that are established, as you'll see, and we'll be able to start to leverage those and assign folks to be able to support the response quickly. And then, of course, having a centralized place to capture all this information and to be able to report on it is critical as well. So as a result, ServiceNow has published these 4 applications. We'll go through each one. We'll talk about how to get access to these, how to install them in your ServiceNow instance, and how to do some general configuration. Of course, if you need any help, the folks at Alcor are happy to support any way we can. Time is of the essence, obviously, and so we're happy to do that. First and foremost, some background on the emergency response management application itself. Based on, as I said, some of the standards established by FEMA, it leverages a process that allows different folks in different roles to initiate work, starting with, at this stage, a planning section chief identifies a crisis, an incident is created. I'll show you this in ServiceNow. We create an incident. It will initiate some workflow in the background with some defined steps for that crisis type. This can be updated as required. The initial out-of-the-box configuration obviously was in response to what's happening today, but absolutely able to update that and make changes as required. As the incident is created, we can assign field locations. We can recommend and assign required positions for the response. It's submitted to the incident management team, and it's assigned a resource unit leader to start to look at the resource requirements. The resource unit leader will open a scheduler for a location, add any new skills or positions as required, start to assign resources to those positions, and start to align those requirements and fulfill those requests for staffing based on operationalizing ICS guidelines and best practices. So I'll stop there for a second and just sort of jump into ServiceNow Store so you understand where this information lies. It is published up on the ServiceNow Store. There are 4 applications that are available: emergency self-report, emergency response, emergency outreach, emergency exposure management. It will ask, you can hit get, it will ask you to provide your high credentials. So an administrator in your organization will need to go in and to be able to do that. I believe it's already available on most instances, most customers' instances. And if you go to plugins in ServiceNow, you'll find a list of available applications that you can install. And if you do, just give it a second to load. What we'll do is do a quick keyword search on emergency, and it'll show you the 4 applications that are available to be installed, which are in alignment with what you're seeing on the ServiceNow Store. And you'll see the 4 applications down at the bottom here: emergency self-report, emergency response operations, emergency outreach, and emergency exposure management. Once installed, you will see 4 new applications on the navigation pane on the side, which is a result of activating those plugins. It will also create a number of application sets up here in the application picker for the folks who are a little bit more technical. We'll get into that just yet. And so as a result of that, you now have all of those. What you'll get specifically when we look at emergency response, as we just noted, again, was the ability to generate a IMT incident, in this case to define what it is, the start date, the type of incident: outbreak, environmental health, natural disaster response, exercise deployment, other, and the ability to leverage workflow underneath it to define standard response process or customized as required to be able to identify the outbreak locations and the resources that are required as part of this. As noted, because this is part of a federal standard, we have some standard positions: agency administrator, incident commander, et cetera, that you can leverage out of the box. You can create your own, as required, but that will allow that process to kick off and start to look at the staffing as it relates to specific locations and the specific roles. Again, we're going to outline some of the schedules around that, but this is what we're getting with the emergency response application. So what do we get with that? Look at some of the benefits of that. So the ability to digitize the critical workflow, improve speed, accuracy, and efficiency, optimize resources in critical locations, simplify role assignment, And so what you're going to get in the system as well is some predefined roles. And so if I go in, for example, as an IMT admin, IMT deputy, each one of these folks will, somebody will be assigned this role in the organization. And through that process, they'll be able to initiate this, they'll be able to request the resources, they'll be able to assign the resources, and to be able to track information related to staffing those locations and support of the response of this. Again, as I mentioned, definitely opportunities to update some of this. We can configure the locations, the positions, the roles, the schedules as required, but fairly quick and straightforward to set up and to get going, to start to be able to ensure that that's in place. The second side of this, or the flip side, if you will, is more about the employee and organizational response to a healthcare crisis. And it gives us the opportunity to do a couple things. It allows us to send notifications and communications to folks across the organization, to provide information, to ask questions, to be able to report on things. And it also gives folks an opportunity to self-report and get information on their own. So part of that process is the ability to an employee to self-report. They can register themselves as quarantined or request to work from home. We can look at an impact assessment based on, as you'll see, interactions with other employees. We'll identify that, and based on that, we'll look at has the employee impacted other employees, yes or no? If so, we can communicate to the folks that potentially may have been impacted, and have a way to be able to track those things as we go along. And we look at some of that within ServiceNow. As I mentioned, there's 3 new applications that are really geared more around the self-service user. I'll give you an example of that. So if I'm going to go in as Adam Smith here. And so Adam, who is a manager in our organization, has a couple of folks reporting into him. Adam has some emergency self-report homepage that he can log into. He can report on his own health, whether he is experiencing symptoms or not. He can report on his direct reports. And so in this case, Adam can report on his own. He's either in quarantine, he's either reporting symptoms, returning to work, or declining to say. And this is a way for management function within the organization to process some of this information. It also helps him understand, in this case, his direct reports, Jane Doe is actually in quarantine, John Doe is not. And a good overview on some of the impact of this issue on his team at large. One of the things that generated here, again, you'll see these a health record is generated. Tasks are assigned to specific folks. In this case, Adam gets two tasks, and has to respond in an appropriate way. And the impersonation here. The other function is the ability to do a much larger emergency outreach. So we have the ability to leverage some notifications. In this case, we have voluntary health check-in or COVID-19 check-in, for example. We can identify who needs to be notified. We can establish the content of the notification itself, and when we can send that notification or resend as required. And additionally, we're able to see down at the bottom who checked in, what the responses were, and give you an example of what that might look like. So this email went out this morning. and show you a preview here. Again, we're able to configure the notification, provide as much information as you like. The folks that get this are going to be able to provide that they have don't have symptoms, maybe developing, I'd rather not say. There's a link to the CDC, Center for Disease Control and Prevention, for some general information. But as this person responds, we can track across the organization how many different types of notifications we sent out, who's responded, what types of responses we got back, and as part of that, we're able to start to mitigate any potential issues or risks based on exposure, and we're able to take some action based on that in support of helping those folks who may be exposed, in this case to COVID-19. The second part of that is emergency exposure management. And one of the things that we'll see here, for example, so let's say in this case, Daryl Ruffins responds that he has indeed been come down with coronavirus. One of the things that we're able to do here is take a look at either based on location or based on with an Office 365 integration with ServiceNow, we're able to look at who Daryl had meetings with, run our diagnostics, and that's going to give us a list of impacted users through location, impacted users through collaboration. We can add users manually as required. And what we can do is create a notification to those folks based on location and ask them periodically to provide us an update on their status based on their exposure, in this case, to Daryl. Of course, confidential. We're not going to leverage Daryl's name specifically, but we're going to ask folks in this group, in this case, to provide status updates so that we can understand, again, back through the emergency outreach, what's happening as it relates to that. And then finally, as you saw earlier, again, the ability to do some emergency self-reporting and to be able to track activities and tasks based on that so that we can mitigate some of the key activities, key issues that may happen as a result of folks being in contact with each other. ServiceNow's got a number of other functions that aren't necessarily in the scope of this conversation, but be happy to speak to folks about just general risk management within ServiceNow, the ability to look at and understand the impact not only to the folks within the organization, but to the services that those folks support and deliver, and to be able to see the impact of that through both the risk register and ServiceNow, and to be able to look at some remediation and some general business continuity functionality that's available in ServiceNow. We can look at that separately if folks are interested. Definitely reach out, and be happy to walk you through some of the more advanced functions of the governance risk compliance suite of applications in ServiceNow. So in summary, take a look at some of the benefits of this. Again, emergency outreach, stay connected with employees, give them the opportunity to respond, whether it's email or mobile push, share important information, which is key. One of the things on the self-service function is a link to a knowledge base. You can post anything that you think is pertinent information to folks within this scenario, and just help raise awareness in light of this pandemic. And then finally, be able to have employees report on their status and to look at the ability to understand the impact to the rest of the organization and start to take the appropriate actions. There's tie-ins to the HR applications in ServiceNow as well We can use some advanced workflows to kick off some of the HR processes that support benefits for short and long term for folks who are impacted by this, and then go through the process of safely returning folks to work at the appropriate time. And then, of course, being able to minimize exposure and impact to other employees for folks who are affected by COVID-19, and have up-to-date information for our management teams to be able to take the appropriate actions. So again, all built on the ServiceNow platform, leveraging analytics, service portal, custom workflow and app development. Definitely opportunities to leverage and tie in other things as well on the platform. The key here is just to be able to quickly leverage this and start the process of responding and mitigating the impact and the risk. All right, so that's all I have for today, folks. If you have any questions, I'm happy to answer them here. If you need any help with any of these applications, we're here to help. We're here to respond quickly. We can jump on a phone call, help you install the applications, help you do some initial configurations as required. We're all here in this together, and so happy to do our part any way we can.
Thank you, Aleks, for such a great webinar. We do have quite a few questions here, but before we get to them, I just wanted to remind to those who have some questions, please make sure to send them to us in the chat box here in the tool. So one of the first questions that we have today, Aleks, is what configuration is required to integrate emergency exposure with Office 365?
Yeah, so you'll have to have the Office 365 integration with ServiceNow. You can look at it on the store. There's a couple of different ways to integrate it, but principally it's looking at leveraging integration for communication perspective, to be able to tie in. Where is it? I'll find some specific information around that, and I'll send it to folks. But there is an integration for the inbound email, and to be able to leverage some of the scheduling functions in Office 365, to be able to pull in the folks who may have been part of any meetings with the somebody who was identified as exposed to COVID-19.
Perfect. Another question that we have here is this video will be available after the webinar?
Sorry, say that again?
Would this video be available after the webinar? I guess I can address this one myself. We will send out the recording to all the people who registered for this webinar. Also, I think you mentioned, Aleks, that you are ready to share the presentation as well, right?
Absolutely.
If you need Aleks's presentation deck, please feel free to send us an email in the question box, and we will address it later and send you the deck. All right, quite a few more questions here, Aleks.
Right.
How can you expose the self-report on your service portal to non-ITIL users?
Yeah, well, so the goal here is for folks to be able to leverage this. So anybody who has is a user in the system should be able to access this. We can provide. There's roles within the system, as I noted. So if I'll show you here, that will allow you to participate in this. So you could just add that role globally to folks in the organization. It's completely separate from the ITIL application and licensing. And again, it's free, so you can provide that to everybody in the organization.
Perfect. Here's one more question for you, Alex. How long would it take to deploy and go live with the application?
Yeah, that's a great question. So once you've installed the application, I would start quickly in a non-production environment. Install some of the demo data just so that you can see some of the users, some of the demo data there. And then setting it up in your production environment is fairly straightforward from there. What I would do is configure, again, looking at roles within the organization and the different applications, ones that you want to leverage. Start to look at those. But it's fairly quickly, you should be able to get this up and running within a day and then share this with folks, depending on your expertise on the ServiceNow platform. Like I said, we're offering some initial consulting on just getting this thing up and running. So happy to get on some phone calls this week and help folks set that up.
Awesome. Here is another question. I think this is a follow-up question, Alex, to the previous one we had here about how can you expose the self-report on your service portal to non-ITIL users. So this question states, we don't want our ESS users to be able to log in into the application side. We prefer to streamline their experience to our service portal.
Right. Yeah. So you're saying rather than them going to this is a separate portal, and so you could either create a link from your existing ESS portal, and it would basically appear like a page, but it is a completely separate portal, and as such, it's got some different things happening in the background than the traditional ESS portal.
All right, thanks for addressing that, Alex. Another question, how do you give one role to all the employees?
Yeah, so that's, I'll have to get one of our technical folks just to give you some guidelines on that. But if you you can create a group really quite easily and add everybody within the system and just assign that role. That's likely the easiest one. I'll send out as a result of these questions, what I'll do is just send out an FAQ and get a couple of my technical folks on my team just to provide some key guidance on that front. But I would suggest the easiest way is just to create a group, add everybody in there, and just add the appropriate roles.
Awesome, thank you, Alex. Another question we have here, I know we have a few more minutes. What is the pricing for the ServiceNow emergency response apps?
Yeah, so right now for as far as ServiceNow is concerned, it's free indefinitely. It will at some point require a nominal platform license. I think they're saying $500 a year. So this is not meant to be a for-profit function. It is free for the foreseeable long term. Any updates to that, we'll obviously let folks know. But right now, it's free to install, free to leverage, and I think as the community continues to leverage this, you'll find updates to this either on developer.servicenow.com on the share, on the ServiceNow Store, or on the ServiceNow community.
Awesome, thanks, Alex. We have some multiple messages here thanking you for answering all the questions, and then there are a few questions still here left.
Of course.
Is this application available on the free dev instances? Do you know?
Yeah, it should be on the developer.servicenow.com. It should be made available as a standard plugin as of this date. Developer, and that's for the folks who don't have this. This is it here. And as I mentioned, there's a couple of other plugins that we didn't cover here as well. One is for the HR suite of applications, as far as some notifications. Yes, I would double check when you log into your instance, but I believe it should be available here as well.
Awesome. We're receiving some feedback here. One participant says it is available on the free dev instances. I have installed it on my dev instance already.
That's great.
Awesome. All right. One more question that I have here so far, Alex. Are there any other functions within ServiceNow that can help us to manage the risk?
Yeah, so again, as I mentioned earlier, for folks who have GRC, there are a number of things that that we can leverage here. As I mentioned, there's really two perspectives here. There's the people perspective, and then there's the organizational perspective. And so, as we look at managing risk and understand that potentially we may have folks who can't do their jobs, we need to understand what that means to our business and to the health of our business. And so within the ServiceNow applications, we can go in and look at risk in general. This is for folks who already have GRC turned on and plugged in, and so we can look at some of the inherent annual loss exposures as it relates to these kinds of risks. It just really helps us to get a grasp on what might potentially happen based on some of the things that we're seeing in the news today.
All right. So I think so far these are all the questions that we have today. Thank you so much, Alex, for delivering this wonderful webinar and addressing this very relevant topic. The recording of today's webinar will be available on our website, www.alcortech.com. We will also send you a link to this recording by a follow-up email. If you send your email to me in the questions box, I will also forward you Alex's presentation. Thank you everyone for joining our webinar, and we look forward to seeing you at our next webinar. Thanks, Alex.
My pleasure. Thank you, folks.